The most valuable thing that I learned in the program was that there are many ways to help people. Everyone is motivated by their own passions. Mine specifically is to be an advocate for African Americans and to increase health literacy. But the paths that you can take are practically endless.
I've learned that it's really important to have a diverse team and diverse people in leadership positions, especially in healthcare. We lack a lot of resources in the minority communities. I know there's increasing refugee communities here in Lexington, and they don't understand research, they don't understand different screening process, prevention method. So when we have those leadership positions, we're able to increase those programs in advancing basic information towards the minority communities.
Being involved in hands-on cancer research with my mentor, attending various cancer lectures, and shadowing physicians and oncologists really helped me progress my knowledge in cancer, patient care, and cancer research. The Marquis Strong Scholars Program has already advanced my career, as I am currently speaking with my mentor about future projects that we're going to do.
I would say the most valuable thing I learned was how to think in a scientific way and then also be able to communicate this to other people, which I think is very valuable and is really a big fundamental piece of doing research, because you want to be able to think in new ways and expand on old ideas and make them new, and then also tell this new information to other people.
Overall, I think what I really took away was that being in a career in science and medicine is definitely not a sprint, it's a marathon. I've talked to several really inspiring mentors in both the research realm and then medicine. What set them apart from other people is that they really care about their patients, they care about their research, they just really wanted to work towards bettering the science and doing better for their patients.
No matter where you go, teamwork is a major component, from working in the lab, seeing how everyone works together, to observing tumor boards and seeing how physicians and researchers work together to come up with treatment plans and come up with ideas for clinical trials for patients, to even being able to shadow physicians and seeing physicians I'd previously shadowed work together to come up with treatment plans for their patients.
I think one of the most valuable things I learned was that the world is infinite and limitless, and the more you learn, the less you really know. And it really reminded me how much I love to learn and how much I love to study science. I think another valuable takeaway from this experience is that as a minority, I was not alone as I thought I would be in the scientific or medical fields, and that was really good to see.
As a woman of color in STEM, it's been difficult to find a community where I can be myself and then explore with a team that looks like me. So that was really cool. I'm from a rural town in Kentucky, so there wasn't many people that looked like me, but here I got the chance to meet with a lot of other scholars that wanted to go to the science field